Your mother is standing by the front door with her coat on. She looks at you and says, "I want to go home." And the hardest part is, she is home. This is the house she's lived in for 40 years. The kitchen where she raised you is right behind her. Or maybe it's a different version. Maybe she's in a care community now, and every single evening, like clockwork, she asks you to take her home. Or she's sitting in her own living room and says she wants to go home to a house from her childhood, one that hasn't existed for 60 years. If you've heard those words, you already know the feeling that comes with them. The pull to explain, to reason, to gently set her straight. Mom, you are home. You live here now. And you've probably noticed something. It almost never works. In fact, it often makes things worse. So, in the next few minutes, I'll explain what that sentence actually means, because it's almost never about the house. And I'll give you the exact words that tend to help, the ones to avoid, and why. I'm Dr. Crystal Agner. I'm a licensed clinical psychologist, and this is Why They Do That. Here's the shift that changes everything about this moment. I want to go home is almost never a request about geography. It's a request about a feeling. For most people living with dementia, home isn't the address on their mail. It's a feeling of safety, of belonging, of a time when the world made sense and they knew exactly who they were and what they were supposed to be doing. Home is where they felt competent, where they were the mother, the provider, the one in charge, not the one being cared for. So when someone says, "I want to go home," what they are very often really saying is something like this: I feel unsafe right now. I don't belong here. Nothing around me feels familiar. I want to feel like myself again. And once you hear it that way, you understand why correcting the facts falls flat. You're answering a question about a building. They're asking a question about how they feel in their own skin. Two completely different conversations. In my work, I start from one core idea, and it runs through everything on this channel. Behavior is information. The words, the pacing, the wanting to leave, they're all a signal pointing at a need underneath. So the most useful question isn't, how do I get her to stop saying this? It's, what is she telling me she needs right now? And usually it's one of a handful of things. She might be tired. This tends to show up in the late afternoon and into the evening when the day's reserves are gone. She might be overwhelmed. Too much noise, too much activity, too many people. She might be looking for a person. I have to get home. My mother is waiting. The children need me. She might be looking for a purpose, a role, a job, a reason to be needed. Or she might just be uneasy in a way she can't name, and home is the word her mind reaches for to describe safe. When you start translating the words into needs, your job gets simpler. You are not correcting a fact, you are answering a feeling. Now let's talk about why the natural response, the reasonable, loving, factual response, tends to backfire. When you say, "You are home," or "You moved here last year, remember?" you're doing something completely understandable. You're trying to reassure her with the truth. But here's what it feels like on her side. She is certain she needs to go home. That certainty is real to her. And when you contradict it, one of two things happens. Either she feels you don't understand her, which makes her more anxious and more insistent, or, for a moment, she believes you and grasps just how lost she is, which is frightening and sad. There's a name for the old approach of constantly correcting a person back to the present: reality orientation. And for someone with progressed memory loss, leaning on it hard, over and over, tends to increase distress rather than calm it. You can't reason someone out of a feeling by giving them facts. So we're going to do something different. We're going to meet the feeling first. Before the scripts, one important caution, because getting this wrong can be serious. If this is new, If the restlessness, the confusion, or the distress came on suddenly, over hours or a day or two, do not assume it's just the dementia. A sudden change in someone with dementia can be a sign of something physical and treatable: pain, a urinary tract infection, constipation, dehydration, a reaction to a new medication, or delirium. These can look exactly like a bad dementia day, but they need a medical evaluation, not a communication technique. So the rule is simple: a sudden change gets checked by a professional. A long-standing familiar pattern, the same "I want to go home," she said gently for months, is where the tools I'm about to give you fit. When the moment comes, three moves do most of the work. Move 1. Don't argue the facts, meet the feeling. Skip "you are home." Instead, name what she seems to be feeling and let her know you're with her. You sound like you're ready to be somewhere that feels like yours. It sounds like nothing feels familiar right now. I'm right here. You're not agreeing that she needs to leave. You're agreeing that the feeling is real. Move 2. Get curious about home. Instead of shutting the topic down, open it up. Tell me about home. What do you miss most about it right now? And then listen, because people will often hand you the actual need. They'll say something tender: a kitchen that always smelled like bread, a garden, a porch, a person. And that, the warmth, the person, the feeling of that place, is a need you can actually meet, right here, without going anywhere. Move 3. Redirect toward comfort, not away from the door. This is not distraction as a trick. It's offering the very comfort the word home was reaching for. Pair your warmth with an appealing next step. Let's have a cup of tea first, and then we'll figure it out together. A warm drink, a soft blanket, a familiar song, a small, doable task. Folding towels, looking at photographs, a slow walk arm in arm down the hall. You are giving her the feeling of home instead of the argument about it. Let me give you words you can actually use tonight. Instead of "you are home now," try "tell me about home. What do you miss most right now?" Instead of "you can't go home, you live here," try "I'll be right here with you. Let's have a cup of tea while we figure it out." Instead of "remember, you moved here last year," try "it sounds like you're ready for something familiar. Will you walk with me?" Instead of "there's nothing to worry about," try "something doesn't feel right to you. I've got you." Notice what all of these have in common: no arguing, no quizzing the memory, no "don't you remember?" no correcting. Just the feeling, met, and a gentle, warm next step. And your tone matters as much as your words. A calm, unhurried voice and a relaxed face tell her, underneath everything, that she is safe. Sometimes that does more than any sentence. Now, I want to be honest with you about a piece of common advice because you'll run into it everywhere. A lot of people will tell you to just play along, to say, sure, the car's coming after lunch when there is no car, to agree that, yes, we'll go home soon when you have no intention of going. As a psychologist, I want to tell you where I land on that. I don't lean on fibbing to calm someone, and here's why. On some level, people often sense when they're being managed, and trust is the one thing that makes every other strategy work. Once someone stops feeling truly safe with you, nothing else lands. The good news is that you do not have to choose between lying to her and being harsh with her. There's a third path, and it's the one I've been describing this whole time. Comfort the feeling without asserting something false. I'm right here with you. Tell me about him. Let's get you warm and comfortable. Every one of those is true. Every one of those soothes. And please, hear this one especially. Never repeatedly correct a painful fact. If she's asking for a husband who has died, you do not redeliver that death to her over and over each time she asks. That is a fresh grief every time. Instead, you meet the love underneath the question. You really love him, don't you? Tell me about him. Comfort without the lie and without the wound. And I want to say something to you for a moment, the person doing this. This is hard. It is exhausting to stay calm when you're being asked the same painful question for the 10th time in an evening, when you're tired, when you're grieving the person right in front of you. If you lose your patience sometimes, if you answer more sharply than you meant to, you are not failing. You are human, doing one of the hardest jobs there is. These tools aren't about being perfect. They're about having somewhere to go when you don't know what to say. Be as gentle with yourself as I'm asking you to be with her. You cannot pour from an empty cup. So please, let people help you and take the breaks you're allowed to take. It's not selfish, it's what makes the caregiving sustainable. A couple more things worth naming clearly. If the distress is intense, if it's happening constantly, or if someone's safety is at risk, including trying to leave in a way that could put them in danger, that is a moment to bring in the medical or care team, not to carry alone. And if a person is actively, unsafely trying to leave, safety comes first, always. You keep them safe first and soothe second. The tools in this video prevent and soften a great many hard moments, but they are not a replacement for a care team that knows your person. And they're not a replacement for getting help when you need it.